When I was invited for this first GCCG, was an honor. First to be represented South American group and then be part of this amazing group of experts from around the world was something very special. To be here, not only to work with those people, but also to be part of consensus that in the end will help the patients all over the world. It's something amazing. Attending this consensus, the GCCG, is changing the way I see my patients, because as you have a different opinion for people from different parts of the world that will live different situations in their daily routine, we can understand the way they think based on their own experience in their own country, even when we understand that we are dealing with people from different cultures, where those backgrounds can interfere in the final decision, the final outcome of the treatments. I think the final publication of the concession will be very important. First, because it's the result of more than 1 year that people were working on it. But then after the publication, we're gonna have another challenges to see if the suggestions of the recommendations of the consensus will be good for the practice. Meaning, we now have to understand that we need a second step, that after the publication, we see if the other recommendations are put in practice by all the clinicians or the major of the clinicians. Because sometimes we are worried that we have the publication, but it's only for academic people. If it's go to a shelf and stay there, it's gonna be a failure. But I think it's part of our job to spread out the information of the consensus and to make our best to apply them in our daily basis, to see if you can, in the end, helping our patients with the best evidence. So I think this is the challenge, but we are very enthusiastic that in the end is gonna be very important for the dentistry.